But the idea is that, we're always carrying our phone around, and our phone collects so much interesting information. Not only does it does your phone collect information about like where you are, or who you're talking to, or other things like how well your sleep is, but there's also the opportunity to ask people in the moment, like, how are you feeling, or where have you been, or do you have any of these symptoms? Obviously, because of the problems that we're faced now with COVID-19, this was a really huge opportunity for us to get a sense as to whether or not the phones can detect these outbreaks, basically become a personal screener for an illness without having to go to a drive-in screening clinic, or to go to the hospital, or go to your doctor, and have us figure out, like, is there a blooming pandemic happening? Even though we're in the middle of a pandemic, is actually a really useful time for us to collect information to sort of build out the predictive signal, or the predictive algorithm from the phone, so that we can start to test it again in the fall and in the winter months. Because this is actually a very simple study to participate in. You don't have to come to the university. You don't even have to talk to anybody. Everything is done through this mobile application that you download through your phone. So it's actually the perfect research study, because you can still adhere to the social distancing rules that are out there right now. So one of the uses for this is that if we can say early, whether or not there's going to be another COVID type of virus, one thing we could tell is whether or not it's a current COVID virus, like one that we already have a vaccine for, like SARS and MERS, or is it a brand new one like COVID-19 is to us right now. It's very inconvenient, obviously, to be having to work from your home, for schools to close. The reasons why they do that is because so many people were infected. You may not have to be in that situation if you can kind of prevent that exposure from happening early on. Anything we could do for early recognition would absolutely, early recognition, early intervention would prevent a pandemic.